Hi there. This is a look at our TFT reports as part of our pathology system. Um, Not a huge amount to highlight here. The admin section is nice and simple, so just some retrieve and save, and then one to think about following up. As always, up to you as a practice how you want to use that. The clinical review section is quite a lot longer. Tend not to find huge numbers of patients in here, but essentially there are quite a lot of scenarios where due to either the combination of T4s and TSHs, or things that are going on with the patient, like being pregnant or a history of thyroid cancer, mean that a more individualized review is needed. There is also a bit of a kind of safety net here of TFT abnormal and not picked up anywhere else in our system. Um, Up to you whether you get those going all to have an appointment, um, or whether you want to task GPs to look at these, or someone works off the report. Either way, you would definitely want to be using that TFT template. As normal, that will show why they're needing review and give relevant, useful information. We've got a section again for diagnoses. These can be automated. As ever, the downside with the automation is it won't create problem headings, so you may prefer to do this manually, and we've put in sort of some of the details and suggested codes to add. Discussion requested by the patient. Again, we've got 0 because we're directing those patients to have an appointment with a pharmacist, or you can work off those manually. Medication that's been agreed. Again, you've got either increasing or decreasing thyroxine doses. The comms annex options, again, these can be automated, which is why we've got no patients in them. Effectively, they are sat in this retrieve and save. Finally, as ever, letters can't be done automatically, sadly. So there are some to send, or particularly for these ones where there are questionnaires, you may want to think about just picking up the phone. Some practices find that approach works better, because otherwise you're sort of waiting for the patient to get back to you, and it can be a bit slow and so on. But again, up to you as a practice. What we'd recommend you do as ever is that you use the pathology spreadsheet to record your decisions and your approaches to how you want all of this to work. Thanks very much.